Hello, everyone, and welcome to this edition of the Original Strength Podcast. Today I am talking with Dr. Catherine Schmitz. Dr. Catherine is a distinguished professor at Penn State University in the Department of Public Health Services, and she's also a distinguished professor in the Department of Physical Medicine and Rehabilitation. Dr. Schmitz was a wonderful guest. She is the leading researcher in exercise oncology. In fact, she's written a book called Exercise Oncology, and she's also written a book called Moving Through Cancer. Wonderful conversation about how your body is made to heal and how maybe even moving can prevent cancer and help you recover from cancer should you get it. Anyway, I think you'll find this conversation fascinating. Dr. Schmitz was a wonderful guest with a ton of information. Thanks so much for listening. Pull up a chair and buckle up. It's the Original Strength Podcast. So, Dr. Schmitz, you are a leading researcher in exercise oncology. And as it turns out, you've even written a book called Exercise Oncology.
Yes.
What is exercise oncology?
Okay, so exercise oncology is the term that we use to define a field of exercise and cancer, things having to do with cancer. So it really extends, exercise oncology extends from primary prevention and epidemiologic research studies that help us to understand whether if we're more physically active, we're less likely to develop cancer to begin with. The answer is yes, by the way, for 7 common cancers. Don't ask me what they are. It's always like the dwarves. You always forget the 7th one. And I'll try if you want. And then it also extends to, the studies that we do in animals and in humans to try to understand the potential benefits of exercise for those living with cancer and going through cancer treatment, and all the way through to understanding, again, epidemiologic studies to understand whether being physically active reduces the likelihood of recurrence or death of some cancers. The answer is yes, for colon, breast, and prostate. And increasingly, there's real interest in the potential of exercise in the palliative setting, in the setting of metastatic cancers as well. So exercise oncology is intended to be a very sort of a short way of saying that we're working on research and practice in the area of exercise for people who are at risk for, have had, and have survived cancer.
So that's really what. So when I read what exercise oncology was, I just wanted to hear your answer. But you mentioned the key word that I was really fascinated about, and it was prevention.
Sure.
And so I think, and everybody knows, I think everybody knows that exercise or moving is good for the body. It's good for the person, the whole person, mind, emotions, body. And I think though we always think, well, yeah, exercise can prevent diseases like heart disease and diabetes and things like that. But I don't always hear really anything about
Cancer.
exercise preventing cancer, which is really fascinating to me.
Yeah, and what's interesting is that the evidence base for this is truly robust. There actually have been a number of reviews that have come out, Tim, in the recent years that are from a variety of places. So it's kind of neat when you have experts from around the world coming together to do these pooling projects and umbrella reviews, various different ways of taking the evidence base, the epidemiologic evidence base in this case, and tilt it this way, include this study, exclude this study, turn it this way, tilt this way. Every which way you can do it, it comes out the same way. We get the same, base of cancers. There are about 7 cancers, like I said, for which we have striking epidemiologic evidence that exercise reduces risk anywhere from 10 to 20%. So it's a robust reduction of risk. If we look at, for example, what is the reduction of risk or delay in onset of breast cancer for taking chemoprevention, right? It's on the same order as being physically active. Wow. So I'm not suggesting that somebody with BRCA mutation should exercise rather than taking tamoxifen. That's not what I'm saying. What I'm saying is that it is robust. It is a large enough effect that we really should be paying attention to it.
So really, it sounds like you're saying the body's designed to move.
Oh, the body is very much designed to move. And what I would also say is, if we can flip to the other end of the spectrum, the body is intended to move to the moment we die. The body is intended to move until literally the moment we draw our last breath. It is intended to move when we have brain mets. It is intended to move when we have bone metastases. It is intended to move the entire time we are breathing. If we're in the ICU, they move the body.
And we're done now. That completes the interview. That was everything right there. No, so we teach what's called original strength, and basically the premise is you're supposed to be strong and able your entire life. That we don't have this internal program that starts to break down your body after you reach age 33 or something silly like that, where everything just starts to fall apart. But no, that's beautiful. Body's made to move always.
It is made to move until the last breath is drawn. Yeah, one of the things that's been a really interesting shift in the field of exercise oncology over the past couple of years has been the greater and greater inclusion of metastatic patients in our trials. And I'm very active on Twitter. I'm Fit After Cancer on Twitter, and when I post about my trials, the first thing that comes up right away is always somebody saying, "Why aren't you including metastatic patients?" And I do include metastatic patients in many of my trials. And but when I started in this field, 20 years ago, literally 20 years ago, it was verboten. The idea that you would work with the metastatic patients was no, they're way too sick. There's too much going on with them. And a number of things have shifted as a result of changes in the way that we treat metastatic disease, and the fact that people are less disabled by the treatments that are offered for metastatic disease. The other thing is, I don't know if you're aware of this, there are 150,000 women living in the United States right now who have metastatic breast cancer.
I was not aware of that.
Yeah, isn't that a big number? That's a big number. It's a big number, and some of them are living their best lives. Some of them are fit and healthy, and they have metastases in their liver or in their lungs, but the drugs that they are taking are better and better, and it becomes, unfortunately, a game of whack-a-mole of this drug works and you take that for a while and then it doesn't, and then the tumor's mutated, so you take something else, you try something else. So you start to play catch up a little bit. But I think those folks need to be moving, and that's a big focus for some of my current research. I have an ongoing study called Nurse Amy. We have actually several versions of it going right now, and one of them is in metastatic breast. We've developed a supportive care platform that is delivered through the Alexa, through the smart speaker system. And the reason we did it through that is that we found that some of the women we dealt with in the earlier version of this trial with a tablet, the older women didn't know which button to push. Where do I go? So instead, Alexa, open Nurse Amy is something anybody can say. And we include strength training and balance and flexibility and walking. They get a Fitbit and we get them walking, and they find that they really enjoy it and that it really helps with their symptoms. And when we ask patients, what do you like best about the Nurse Amy program? And there's meditation, there's soothing music, there's lots of things on it. But what they like best is the walking. That's what they feel is most helpful to them. So isn't that interesting?
It is, because I was actually sitting there thinking when you were telling that what Nurse Amy did and you mentioned all the exercises, I was wondering, what would you think would be like one of the best movements or exercises a person could do? Like if you had to choose one that may make the biggest impact on their health or their recovery.
Yeah. If I get 30 seconds with a patient and they're like, all right, tell me what to do, I'll tell them what. That's because usually they're not doing that, and that's the easiest thing I can tell them to do. Now, my favorite thing to tell them to do, if I've got the time, is no, is strength training. You know, I think I think strength training is probably the basis for everything else, because particularly in the setting of advanced disease, you're losing lean mass, and there's always the risk of development of cachexia, and that starts the spiral that leads to death, unfortunately. So if we can keep more active protoplasm, is one way of putting it, then we can keep that active protoplasm, helps the body fight the tumor. So
That is awesome. So you got all this research and all this data about how exercise helps survivors and helps them recover and like improves mortality rates and things. And it seems like, well, yes, of course it does. But but exercise hasn't always been prescribed for cancer survivors.
No, it hasn't. So yeah, this is the purpose and the mission of my work for the remainder of my career is, we have a robust evidence base. Tim, it doesn't mean that we don't need more evidence. There's a new sort of subfield of exercise oncology that is extremely exciting and important and nascent at this point, and that is looking at whether exercise has the potential to potentiate the treatments that we give. Is it possible that by being physically active during chemotherapy, you're better able to tolerate chemotherapy? There's some important research that's coming in that area. But that said, we have a robust evidence base that tells us that exercise is useful for a whole variety of symptoms and side effects, and for function, and your ability to simply get around, and as the Brits say, to get about. And we need to be prescribing exercise. And the problem is that, I want to tell you a bit of a story, if you'll allow me.
Yes.
That we keep learning the same lesson over and over again, Tim. And so the story goes back to the 1950s, when then sitting President Dwight Eisenhower had a heart attack. He was a sitting president and he had a heart attack, which would be huge news today, but somehow nobody seems to know or remember that Ike had a heart attack, right? So he had a heart attack. He was in Bethesda Naval Hospital, and his cardiologist was none other than Paul Dudley White. Wolff-White syndrome. I mean, this is like big name in cardiology, right? So he was sharply criticized. His cardiologist was sharply criticized for getting President Eisenhower out of bed so quickly after his heart attack. 3 weeks after his heart attack. 3 weeks. Okay. We laugh at that now and we say, that's ridiculous. We get people up, right away. We know that exercise is good for people who have had a heart attack. We have this thing called cardiac rehabilitation. We learned the same thing about back pain. I don't know if you're old enough to remember that we used to tell people to rest for back pain. And we then figured out, no, that's a bad idea. Pregnancy. We used to tell women to rest in pregnancy, and we don't do that anymore. We seem to need to learn this one condition after another, right? Okay. And so we have this robust evidence base, but having a scientific evidence base doesn't mean that the practitioners who are treating the patients or the patients themselves have any idea that research exists. So I did edit the book, Exercise Oncology, as you mentioned, but I actually have written a popular press book now too, called Moving Through Cancer. It's coming out in October, and you can find it easily at movingthroughcancer.com. Pre-order is available there now. And the idea behind this book was science communication. The whole idea was, well, there's this robust evidence base, but the average person on the street doesn't know it. Your Aunt Betty has not heard of exercise oncology, or all of the benefits that she might have if she's more physically active during and after her cancer treatment. So I wrote the book with a wonderful oncology journalist at my side, and it has a couple of chapters that kind of guide people, but it has a program basically, and the program is divided into the timeline that you go through your cancer. So there's a rehabilitation program prior to starting treatment, and then a recovery from surgery, and then a chapter on chemotherapy, hormonal therapy, reconstruction, and then little bits and bobs for chapter on caregivers. I am a cancer caregiver myself. My wife had cancer 4 years ago. And so wrote that one from a very personal perspective, and a chapter on all of those amazing athletes that we hear about. Gabrielle Grunwald, Keegan Randall, and Lizzo Riordan, Bill Jolly, and Sydney Hooper and Susan Helmrich. All of these people who have had cancer and are masters athletes competing in Ironman competitions, showing us what's possible, showing us that what you teach in original strength is spot on, and that is that we are meant to move. So keep moving despite your diagnosis.
Amen. So since there's then we always seem to have to learn the same lessons over and over again, and it always also seems like once something is discovered, there's like a lag time or a gap time
14 years, yeah,
before everything else catches up, which seems like forever. And it's like, but we've known this forever, but now we're just now practicing it. So how long? Well, I mean, your mission is to close the gap,
right?
And so you've got moving through cancer is one of it. What other ways are we trying to close the gap?
Okay, I'm so glad you asked. So I ran for the office of president of the American College of Sports Medicine a few years ago on the platform of saying we need cancer to sit side by side as an equal to heart disease and diabetes and obesity as chronic diseases that we focus on at ACSM. And I was elected president. I was unapologetic about the fact that I was going to be focusing on trying to promote exercise oncology. So I figured I got elected, that there's my mandate. So as part of my presidential year, I started a new initiative called Moving Through Cancer. That's the same name as the book on purpose. And the Moving Through Cancer initiative has a task force that comes together that's a multidisciplinary group. And that group came together and formed an agenda for, okay, if we are here and our goal is to get to our end post is, everybody knows that exercise is good for cancer patients and it's being prescribed for all people with and beyond cancer. What do we need to do? And so we came up with 5 different sort of topic areas that we really needed to pay attention to. We needed to develop the workforce, because right now, if you ask the average trainer on the street, are you ready to work with cardiac patients? Yes. Are you ready to work with diabetics? Yes. Are you ready to work with the obese? Yes. Are you ready to work with cancer? Right. So we need to fix that. Okay. So we have a whole host of things that we're trying to do to try to boost the workforce, because 4% of the US population are cancer survivors, and we have another 1.7 million diagnosed every year. So we make cancer survivors, by the bucketful at this point. So we need to have more trainers ready to work with this population. Program development. There aren't enough programs right now. There are places in the country where it's good to be a cancer survivor because there's a lot of exercise oncology. Interestingly, Tyler, Texas is rich in exercise oncology programs. Isn't that fascinating? And then, where there's like big cancer centers, there's likely to be a program as well. But we need to, patch that patchwork quilt. Research and evaluation, certainly. And we need to do a lot in the area of stakeholder awareness, empowerment, and engagement. And that's why I wrote the book that I wrote. It was part of the mission. And then policy. We really need to change policies so that we understand what the cost of these programs are. And we need to do the kind of research that is necessary so that Medicare and Medicaid in the US will start to cover cancer exercise programs the way that they currently cover heart exercise programs, right?
Yeah.
So those are the topic areas, and we have robust research and programmatic efforts in the task force in all 5 of those areas to try to press this agenda forward. I could stop working at Penn State and do nothing but this for the rest of my live long days, and I think maybe if I did that, we might get there. But it's going to take a village, and it does, and there is a village. There is quite the lovely village.
Sounds like you are raising the village.
Yeah. So the good news is that there's a lot of junior investigators, a lot of folks interested in the area of exercise oncology that are coming up, that are very, very much in their training phase. And so I think the field is growing in a way that the field of heart disease and exercise grew back in the 1980s and 90s.
Do you think one day there'll be like and there maybe already is in some spots, but like more of a holistic team approach where you've got your doctor, your physical therapist, your trainer, and all your other specialists that are just all hand in hand together to help?
There are a couple of places that are doing that. There are a couple of places that are really approaching that quite well. I think Huntsman Cancer Institute in Utah does a fairly good job of that. I think there are a few other examples, but I think that there are physical therapists who are working diligently towards that. I think there are exercise oncology folks that are working diligently towards that. I think, again, it's going to, I actually am working on a paper right now that is relevant to what you've asked. The paper is called What Does Good Look Like? Because, one of the things that we hear from cancer centers is, I don't know how to do that, right? And so what we want to give them is, well, here's 4 examples of, centers that are doing this. So, UCSF has an exercise counseling program. Why doesn't your center? Hospital, 7-hospital system in Kansas has, a robust exercise counseling program. There's 44 locations, associated with this other organization, et cetera, et cetera. There's a bunch of different, there's one in Australia that's really, really remarkable. So, how do those things work? What do they look like? Let's take, pull up the hood. Let's, show them the engine and how those things work. What are the logistics of how that works? So that when you go into another cancer center or hospital and say, hey, you want to do an exercise oncology program? And they go, well, how would we do that? And just say, here's the recipe, 2 cups of flour, half a cup of this,
And that's how you do it.
That's how you do it.
So if someone wants to learn more, let me backtrack. If a personal trainer or a therapist or a clinician wanted to learn more about specializing in helping someone recover from cancer or exercise oncology, what resources, where could they go?
Okay, so that's one of the things we're working on in the workforce area. Right now, we're in a little bit of a flux because we are moving from what we were doing to now. ACSM is going to be joining forces with Anna Campbell from the UK, who has developed what I believe is internationally the gold standard for training trainers to work with cancer patients. And she has quite the range of things. And so, we recognize that, we don't want, in the same way that you don't want every trainer to be ready to do cardiac rehabilitation. That's not what we're asking for, right? So you don't want to train every trainer to be able to work with the sickest cancer patient, right? But you do want every trainer to know some basics so that if they have somebody come in who's too sick, they know it. They understand what they're looking at and they say, you need to go over there. You need to go to the clinical person, right? In the same way that somebody comes in and says, hey, I had a heart attack 3 weeks ago. Can I work with you? And any trainer with her salt would say, I think I need to send you to cardiac rehab, right? So there's the hour-long, awareness session, and then there's, a 3-hour-long expander, and then there's a week-long course, So ACSM is joining forces with what's called CAN Rehab. So if you want to Google for CAN Rehab, you can find that. It's open to the U.S. Market now. But we're trying to make it easier for the U.S. market to find it by linking to it from ACSM. So,
okay.
So that's coming. There are other training institutes that are available in the U.S. The key one in the U.S. right now is called Cancer Exercise Training Institute, which is run by Andrea Leonard. So she's independent and runs her own program.
Awesome. And so for the
The other,
layperson,
can I say one more thing?
yes, ma'am.
The other thing is that there is help coming. One of the things that we've recognized is that, one of the most popular undergraduate majors in universities in the US is kinesiology. I don't know if you knew that, but it's a very, very popular undergraduate major. And there is not currently in most colleges and universities a standardized course in exercise oncology. And so Anna Campbell, Anna Schwartz, and I are writing a text called
Awesome.
Essentials of Exercise Oncology. It'll come out in 2024. Our plan is that it takes time for these things. Our plan is to have kind of a white labeled course that will make it easy for colleges and universities to have like a junior level course that will be called Exercise Oncology. That will be easy for them to teach because we'll give them all the PowerPoint slides. We'll give them all of the information that they need, to, all the test questions and whatnot. So, my hope is that by 2030, exercise science programs across the country will include a course in cancer in the way that they currently include a course on cardiovascular disease, and they currently include a course on diabetes and obesity.
That's how you close the gap, right there.
That's right. It's the long game, man.
It is. So your new book, Moving Through Cancer, is coming out in October.
Yep. It's available for pre-sale now, so you can get it. You can go get it now.
Yeah. And that's for everyone, the layperson and the professional.
Yeah.
The other thing available for the layperson that's not into training other people and that's not into helping other people move better, that they just themselves want to move better, the message is move.
That's right. That's correct. That's correct. Nobody benefits. I mean, this is the message to the person who's dealing with significant symptoms. Yeah, you're having significant symptoms, but nobody benefits from sitting on the couch all day. No one. It doesn't matter how you're feeling right now. You are going to feel better if you stand up for a little while.
Amen. Dr. Schmitz, that was awesome. Thank you so much for being on the show.
Yeah, you're so welcome. Thanks for asking me.
Thanks for listening, everyone. Have a great weekend.